Welcome to the Village Talks podcast. This is a space where physiology meets lived experience, where we talk honestly about the body, the nervous system, relationships, and the real questions families are asking without fear-based narratives or one-size-fits-all answers. We're your hosts. I'm Dr. Jaimy.
And I'm Dr. Brittany. We're chiropractors, perinatal specialists, and humans who work closely with families through preconception, pregnancy, birth, postpartum, and early parenthood. Whether you're preparing for pregnancy, currently pregnant, newly postpartum, raising a little one, or supporting someone who is, you're in the right place.
Let's get into today's conversation.
Hello today, everyone. Welcome to another episode of the Village Talks podcast. Today we are talking about the language in pregnancy, in birth, and postpartum when it comes to how things are described in the more modern medical model and how we can kind of reframe it and not let it sit with us, because language is actually really powerful and it does impact us in ways that we aren't always aware of. So we just wanted to bring light to this conversation and how we can, like I said, reframe it for a more positive experience. Yeah.
For sure. And I think even some of the language a little bit past pregnancy, when we talk about postpartum, and even talking about like the language we use around babies, right? And difficult babies and spoiling babies, and
lazy
things
latch,
like that.
Mm-hmm.
Yeah. So I mean, I think across the board, language makes a big difference, but then a lot of it, I think, is unconscious or subconscious, right? I don't necessarily think that a lot of the language was developed to intentionally be dismissive or imply failure, maybe. But I mean, just even that word, failure to progress, right? Failure to progress in labor. You're not failing at anything, right? What's the obstacle? What's going on here? Right? What can we like? Yes, we do want there to be progress, but just because we're not seeing progress doesn't mean you failed.
Exactly. Yeah. And progress looks different for everybody too, right? Like a lot of the language that was given in these circumstances, I think, just from my own perception, my own research and understanding and all that kind of stuff, is from people who didn't understand birth. They gave them labels because they needed to label something. They needed a diagnosis for something. And, you know, this is what we came up with, unfortunately. Like the one that kills me over time is the incompetent cervix comment. And it's like, can you imagine? Just sit there and imagine if you were a man and your doctor told you that you had an incompetent penis.
Right.
Like, just what?
We don't even use the word incompetent. In any other, to describe any other part of our body except female reproductive system. It's also, we talk about the irritable uterus. Like, oh, shocking, another female body part that's irritable.
She's just irritable. And you're like, and I do unfortunately do think some of it does stem from where that women aren't as level-headed as men and all that kind of like old belief system, right? Of this whole like the patriarchy stuff. But like it's there. We can't say that it doesn't exist because we still use that language. And like these aren't like fluffy words. These are very disempowering words that are being used to describe very important reproductive systems and
they're
a very
not
big
medical
experience.
words.
Exactly.
Right. They don't actually medically explain what's happening. Right. It is a, let's just say it, insulting word applied to our anatomy to explain how those parts of our anatomy are inconveniencing the person that perceives themselves to be in control of a situation.
Totally. Absolutely. Another one too, like, is the failure to dilate. That's another one too. And I'm like, well, what, again, like you said, like what's happening, right? Like what is happening in the situation with birth, like where we aren't dilating? Do we not feel safe? Is baby not descending? Is there something that we can do position wise and movement wise? Like, are we trapped in a bed and can't move.
Yeah.
Okay, well, we know movement is really important to help baby navigate the pelvis during labor. So what can we do to help and assist all of these situations that need to happen, right?
Or are we trying to force something on our own timeline, right? So it may not be any of those things. It just may be that this is not the time that your baby and your body would have physiologically chosen for labor.
Absolutely.
And so we are trying to progress something through force instead of looking at some of the anatomical things, some of the physiological things. Is there an obstacle? Are we trying to force through an obstacle?
Yeah.
Are we trying to force too early? Or, sometimes there can be an instinctual reason for baby to not progress, right?
Yeah.
There can be something with the placenta or the cord that we don't know about.
Totally.
There can be any number of things, but I always think back to we no longer diagnose women with hysteria. Right? 100 years ago.
Praise.
Holy moly. Anything and everything that wasn't just quiet, compliant woman was hysteria.
Yep.
And now that's ridiculous. We look at that and think, oh, funny, 100 years ago. At some point we will use the same phrase to describe incompetent cervix, failure to progress. We will move beyond these, but it starts with all of us. Stop using that language.
Yep.
It's not medically accurate, and we are trying to describe something that is happening within the body.
Yeah.
We can use we can use more accurate terms.
Yeah. And I will say sure, we don't diagnose women with hysteria anymore, which just the fact that it even happened. I'm just anyway, it doesn't actually mean though that the thinking behind certain things where that still isn't there, right? Oh man, in your mind, she's asking me all these questions. She's just being hysterical. Okay, great. I'm going to label her as a non-compliant patient. And then I'm going to have to do all these things. And that thinking, unfortunately, is still pretty prevalent in this model. And so step one, is changing the language. But step two is recognizing that you still have that in your schooling, in your teaching, and how we work in these environments and stuff like that too. It's still there for sure. And different populations, different races really do experience different styles of treatment. For sure. That's not something that we can just brush off. It's real.
Yep. Yeah. And it's not just a language shift and a word shift. It's definitely a mindset shift.
Yeah, for sure. Yep.
And it is interesting how insidious some of this is in education. And then it sort of becomes embedded in when you're in school, right? When you're in a mindset where you are learning, you are obtaining and retaining information, and you're using that information to then go out into the world and practice or speak to and support patients through this journey. It's there, right? It's underlying. And I do think it's a little bit, it is institutional, right?
Well, it's reflected in policies. It's how we go about procedures and things like that. It is there, not always. And there are people who are doing better, which is great. But the fact that we still haven't changed the language in some of this stuff is real. My favorite one, which eventually I guess I will be a part of this statistic, is geriatric pregnancy. 35. Once you're 35, 34 and some change, you're fine. And then the minute you turn 35,
cross that line, and
all of a sudden
it's all downhill. You're old. Everything.
Your uterus is old.
Everything's
your placenta's gonna die. All this stuff, and you're But it's not even backed in research. That's the biggest thing too. Who was it? I just saw a recent podcast episode. Oh, it was Dr. Stu from Birthing Instincts. It wasn't on his podcast. He was speaking, I think, as a guest on a different podcast. But he actually goes behind, he did some research and his understanding behind it of where it all came from. It's an insurance game. Yep. It's all, we'll cover this if X, Y, and Z happens. And so the minute, that's why it's such a very the minute you hit 35, all of these things change. And it's like, okay, show me, like actually show me the research that backs that policy up. And it's not there.
It's not there. And, you know, the risk for most things increases as we age. So, but we still have to look at you and your baby and all of your risk factors the same way that we would before 35.
Yeah. I mean, the same thing that happens at 35 can happen at 25.
Yes.
When it comes to birth.
And you can get to 45 and none of those things can happen.
Exactly.
Right. So it's frustrating to see it just become very black and white, right? Without the nuances of this individual person and their risk factors.
Yeah.
I did see, for many years, the largest growing age group for first-time moms is 35 to 44.
Yeah.
So like this isn't, 20, 30 years ago, the frontier of fertility and, seeing people getting pregnant later, like fine. That in the 80s, not knowing what to do with a 40-year-old that was pregnant, fair enough, and not understanding what the true risk factors were. That is not the age that we are in. This group has been growing for decades.
Yep.
In our practice, the majority of our patients, whether pregnant with their first or their 8th, are over the age of 35.
Yep.
So this isn't a small portion of the population.
Yeah.
It is a consistently growing portion. We do now have clinical research and statistics to be able to look back and say that, you can get to a certain point where these outcomes are more likely than these outcomes, but oftentimes it's not even a statistically significant number.
Yeah.
Is it possible? Yes. It's always possible.
Yeah.
Is it more probable at 40 than it was at 30? Possibly, yes. But is it still very probable? No. It is still highly, highly, highly unlikely to happen.
Yep.
And, some of the things that go into these risk factors are those who are not getting consistent prenatal care, those who don't know they're pregnant until later. So you kind of have to tease out some of the details of these statistics that we're constantly quoting. And when we look at the average person in this age who is getting consistent prenatal care, the likelihood of these things getting missed and the likelihood of things going south is actually incredibly low.
Yeah.
And so, we don't want to ignore the risk, but we don't have to assume that because it can happen to 0.08% of the population, that the other 92% of the population.
Shout out to Jack, because I can't do math in my head.
that everybody else has to be subjected to this automatic assumption because of this really crazy low risk, right? There needs to be a balance of, yes, you hit 38 or 30 or 35 or 38 or 42. Are the risks higher? A lot of them are. Our cells are older, our tissues are older, our organs are older. Fair enough. Things don't get easier at 40 than they do at 30. Take that with a grain of salt. But also, what we find is it means more intervention. And more intervention in this country doesn't mean more safety.
Nope.
So
or better outcomes.
We have more intervention here than in virtually any other country. Birth costs more here. Than in any other country. And we don't have the best outcomes. In fact, we have the worst outcomes of all developed nations. So, yes.
I would say my biggest answer with that is it depends, right? It all depends. There's so many different variables, and you could be a really healthy 40-year-old and have wonderful births. Totally possible, right? And it's not just the woman, it's also the partner and all that stuff. And there is a combination of how are you both caring for yourselves going into this too. And that applies at 25 as it does at 45. But at the same time, yes, there are things and factors and that change and stuff like that too. But there with this whole I don't love this answer when I have to give it, and I give it a lot, is when they ask black and white questions. Well, it depends, because there's not such a black and white answer for certain things like this, right? But I think what we need to understand as we're going through this is the language is just as important, and it needs to create a shift. There needs to be a shift in all of this stuff, because just because you're 35 doesn't mean you're going to have an incompetent cervix.
Yeah.
Or you're going to fail to progress, or, right?
Yeah.
Like there's lots of different things that go into it, but all of these labels do impact how you feel about it. And it's going to impact your neurology. It's going to impact, like, even if you can say like, yeah, I let it brush off my shoulder and it's okay, there might be one thing that sticks.
Yeah.
And that will really impact your experience too. Yep.
Well, and seeing people get labeled high risk.
Yeah.
Right. So
relative risk.
Yeah.
Risk.
It's interesting, because some things, like, there's better medical terminology. There's better phrasing. Like, now I hear people say geriatric pregnancy less, but we really frequently hear advanced maternal age, which is like a little bit nicer.
I'm just going to put some glitter on geriatric pregnancy.
Yeah, but we still wanted to be clear, like, you're probably too old for this, or like, this is happening. But and I think high risk is another one, because it creates this perception of danger or lack of safety, right? So going back to some of the nervous system stuff, like when we use these words, our brain takes them in and it imprints them, and it makes decisions about ourselves that we are not choosing, but that still have an impact on how we feel, our level of confidence, our level of safety. And it can be this background static that is creating stress for our nervous system, because if you're labeled high risk, that means things are more likely to take a turn for the worse for you or this baby. Yeah. And I don't know that there is an inherently better phrase, but there's a difference between saying this is a higher risk pregnancy, and I'd like to refer you to this provider. And there are MFM providers who can talk to you throughout your pregnancy like you're having a perfectly normal pregnancy, even though you're there every week getting all these tests done. And you're subject to all this increased monitoring to ensure safety for you and your baby. And there are other MFM providers who will just constantly talk about how you can't do that because you're high risk. Well, you shouldn't be doing that because you're high risk. Well, you're high risk, so that's not an option for you. And it's just like, can you beat it into your brain anymore? Guess what she knows? She knows she's high risk. She knows that her baby's life is at stake every day. You don't need to remind her. Totally. Right? Like, and words can make you feel safe, or the words can make you feel unsafe all the time.
Disempowered too. Like, and that's the other thing too, is like, when you get labeled high risk, are you high risk just because of your age?
Are you high risk because of your physiology and what is happening in your pregnancy? Or did you just get this label because of one thing?
Exactly. Which is not a good reason to be labeled high risk. Just saying. And like the other thing too, like when, and I hate even saying it, but like when you lose your mucus plug, like that I'm like, can we just name it something else? Right. Like, it's just the terminology that we use is still
nobody hears the word mucus and is like, oh
yay, birth is happening, like things, right? Like you hear it and you're like, ew, gross. Like,
but it's funny because this is one where I'm like, I mean, anatomically, yes, like we have increased mucus production in third trimester in order to create.
Can we say we broke the seal? Like something,
it's to create a seal, but it's like, maybe this is where using the anatomical term isn't the most.
I'm like, I love saying like, ooh, like cap came off, ooh, like something, you know what I mean? Like, and again, like my whole thing is to bring back the reference for all of this stuff, pregnancy, birth, postpartum. Like, I know you want to do that too, right? We want this to be a very empowering experience. And that doesn't mean it's all butterflies and rainbows, but it means that the way we look at it is not gross and yucky and weird and that my body is like, all of these things are happening to me and I have no control over it. Like all of that is really how the United States does birth.
Yeah.
Not talking about home birth and all that kind of stuff, but like for the medical side of things.
For the experience that the majority of American women will have. Yes.
We want it to be sterile. We want it to be clean. I am sorry, but birth.
Nothing about birth is clean. Birth is messy.
Birth is messy and there's fluids and all that stuff. Yeah. But like, it's going back into like having respect and love and care for your own body as a human being too. It's the same for like women's menstruation and stuff like that too, is like, ew, gross. You bleed every month? Ew. Like I have to buy you tampons at the store? Gross. Like, what? This is a natural thing that happens. We need to have that understanding of like, okay, let's understand why this is going on. Yeah. But also to understand that this is incredible. This is really incredible that two things can come together and make another thing.
Yeah.
Yay. Yeah. So all the things that go into that.
Yeah.
What? Like, it's not gross. I'm sorry. But like, I don't know. Maybe it's because maybe I've seen so many births. But like every time I'm at a birth, I'm like, holy crap. Yeah. That was so beautiful.
Yeah.
And it's
just amazing.
It could be a C-section. Like I was in the OR last month with a planned C-section and it was still, we made it such a beautiful experience, right? I was at a home birth 2 weeks ago, right? Like there's so many different experiences that you see. And every time I talk about it, I cry. I just love birth so much.
Yeah.
But like, it's so beautiful.
They can all be beautiful.
Yep.
Right. There isn't a right way or a wrong way. Mm-hmm. And I think when we look at the bigger picture, and we're trying to create a shift with language, it does need to start before birth, right? Yep. Like I do think that a lot of this kind of comes down to, again, some cultural things, like how was it in your family? Like, are you a boy that made it to sex ed in high school and didn't even know anything about a period? Like, you had a mom, right?
Yeah,
like,
maybe, hopefully.
Yeah, hopefully. But I think that we as a society, like, owe it to our children in the next generation to do a little bit better.
Yeah.
Boys need to understand, like both sides need to understand like the anatomy of this, how our bodies work. Some people are interested in learning that more in depth and other people are like, I mean, I don't want to know details, but like this happens to 50% of the population. You need to understand a cycle.
Yeah.
You shouldn't be grossed out by what is a natural process, right?
Well, and if you want to have a relationship with the opposite sex, you might want to understand what's happening too, so you know how to support them through
That's
that.
That's just it. If you can't, if I mean, you know, red and green flags here, right? If you've got somebody who is completely grossed out and doesn't want to be anywhere near you on your period, red flag. Maybe not a person to have a baby with.
Huge red flag.
Right? Like that's if they can't support you through one period, what do you think pregnancy and postpartum is going to look like?
Yeah.
And then on the flip side of it, you've got somebody who's like, I think you're starting your period tomorrow. Here's your tampons. Here's your chocolate. Here's your heat pad.
That's so nice.
Green flag.
Yeah.
Have a baby with that person. I mean, you know, they may still not be a great person to have a baby with, but it's a green flag, right? Like
for sure.
They're paying attention and they care and they're making an effort to support you in a way that you likely need. Yeah. You may not want that kind of support, but like they're making an effort. If they're willing to do that, they're probably willing to listen and go, yeah, I don't want chocolate. I want potato chips. You know? Like,
give me something salty.
Yeah. So I think, you know, as the generation having kids and raising kids, how we do that impacts like, what do you want this experience to look like for you?
Yeah.
Surround yourself with those people. Teach your people. Teach your partner.
Yep.
If they don't know how to do this, they weren't raised with this, but they're open and willing to learn. Great, teach them, because then that's the example you set for your kids, and that's what they learn to expect from a partner.
Yeah. You
you have boys who understand that women have periods. You have girls who understand that they're going to have a period, and that doesn't come as a surprise to them.
Yeah.
And that they don't live in fear of starting and being unprepared.
Yeah, well, my grandma, when she started her period, she thought she was dying. Nobody had ever told her.
That was my mom.
What was going to happen.
Right. Yeah. Another generation later, that was my mom.
Yeah.
No, her mom had not prepared her for anything. And she was on the younger side when she started, but literally went to the school nurse and was like, I think I'm dying.
Yep.
And the nurse was like, oh no, honey, here's what's going on.
Yeah.
And treated her with compassion, but also like somebody should have told her before that,
Yeah,
you know?
definitely.
And, you know, kind of then moving into birth, I don't expect every male to want to be all up in there and soaking in the fluids, you know, like that's fine. But, you know, balance between that and, ooh, this is gross. Keep me away. I don't want to be around anything.
Yeah.
Because I agree with you. I don't think that birth is always this. Every part of it isn't actually beautiful in the way that we describe beauty, right? Yeah. Like birth is hard, birth is messy, but it is also beautiful and it's also empowering and it also can be a really amazing experience.
Yeah.
But I think that like I was almost a little bit triggered by things that were too fluffy and too flowery and like I really can't stand the almost like toxic positivity around how everything like that's not reality.
Totally.
Right. So implying that everything is always every part of it, every piece of it, and the whole experience is always butterflies and rainbows isn't reality.
Yeah.
But, you know, also only ever watching birth videos where people are screaming and, you know, there's so much blood. Like, I mean, that's also not always the reality.
Yeah.
Right. There's a whole lot of this in between.
Yeah.
And I, you know, we try very hard in the way that we talk to and communicate with patients and in what we put out there on the podcast, but also like our social media and newsletters. Like we try to be realistic.
Yeah.
We try to use language that is supportive. And parts of it, there are always going to be parts of it that are wonderful and beautiful and we enjoy. And there are always going to be parts of it that are really hard and really challenging. And we maybe don't want to spend a lot of time talking about. That's okay. Right. Some people love to focus on the drama and, you know, all of that. And other people are like, I don't even want to think about it or talk about it. I was like, well, you're going to be in it. So you at least need to be aware that it's a thing.
Yeah.
And so, the part of that, it's interesting too with language because what one person wants to hear is a trigger word for somebody else.
Totally.
Right? Like we have a patient right now who's like, do not use the word mama around me. Like it's so like infantilizing and it's just so, she's like, I just hates that word.
Yep. It's the same. So we have another one who like, don't call my kid kiddo.
Yeah. Right. Like there are certain words that people really, really dislike. And I'm like, great. Like share that with me. Like, I don't like when people come in their first visit, like and your name is Elizabeth. Like, do you prefer to be called Elizabeth or Liz or Beth? Do you have another nickname?
Yeah.
Like, I'll call you whatever you want, you know, like I don't need to call you your nickname your mom calls you, but also just because your legal medical record has this on it doesn't mean that you have to go by that if that's not what you prefer.
Totally.
I don't want to call you anything you don't want to be called. You got to share that with me.
Yeah.
I did hypnobirthing with my first and in hypnobirthing, they use the word surges. And I was like, can we just call them contractions already? I was like, I don't have a negative connotation with that word, right? It's the action of a muscle. It's what's happening in the uterus. That's not going to stress me out. I'm like, but if you keep saying surge, like you're losing me every time. I'm like, just stop, right? And then I was like, now I'm like, okay, wave. I'm like, wave is still very much the wave. Word because I'm like, that's absolutely what it is. Like you see it coming. You know it's coming. There's no surprise when you get into labor. Like it does. It approaches the shore. It peaks absolutely, and they're like, oh. It's ebbing away. Like like a wave, I feel like is a really good way to describe the physical sensation of the contraction.
Totally.
But like surge was absolutely like a trigger word for me.
Yeah.
It's like, please don't say that.
Please no more. Yeah. We have clients who are like that too. They're like, surge. And I'm like, I get it. Like what works for one person doesn't work for the other person. And that's okay. And like why I think this is such an important conversation to have is because that language also bleeds into postpartum and it bleeds in, like you said, it bleeds into how we take care of our newborns and how we talk about them.
Infants.
Yep. Yeah. And it's like, again, I really just want to go back to the respect
Yeah.
aspect of it all. You also have to respect your newborn because
Yeah.
they are their own entity. They are a new
Yeah.
human being in this world who went from a really cozy, warm, fluid-like, quiet thing place to, oh my God, it's cold, it's bright, I don't know what I'm doing. Like I don't have all the like big muscle movements that I like, all these things are going on, and their brain is constantly being stimulated and trying to like develop and figure out all this stuff. And we're like, oh, your baby's fussy. That's just their personality.
There's a female comedian, and I think the special's on Netflix. I can't think of her name, but she's got curly red hair and she's super funny. And she had a baby. So like her newer stand-up special is kind of about it. And she's like, you know who doesn't care about gender equality? Babies. She's like, you know, who's this guy? Like, he doesn't smell like us. He doesn't sound like us. Like, it's super funny.
Yeah.
And that's kind of one of the things that she says too, is like, you know, like, a week ago, I was, you know, so happy and content. And now, like, where am I? What's happening? Like, this is super transformative for us. But like, whew, your baby, like, oh my gosh, like what they just went through, and they're trying to acclimate, and they're trying to, you know, integrate all of these external stimuli. Literally every one of them is brand new.
Yeah.
They're used to just your muffled Charlie Brown voice and your heartbeat, you know, like,
Yep.
So yes, I think, you know, that shift into postpartum. And I think one of the things that pops into my head that we hear all the time is like that we're really hormonal.
Yeah.
Right. She's so hormonal. Like, your hormones in 70, it is the biggest 72-hour hormonal shift that any human will ever experience ever. It's bigger than puberty. It's bigger than menopause. It's bigger than everything.
Yep.
So you're damn right we're hormonal.
Yeah.
But it doesn't help to call us hormonal.
Yeah. Like to have a negative connotation around it is not helpful.
And even just use words like, like your hormones are shifting a lot right now. Yeah. Right. Like we can acknowledge what's happening without using it as a label with a negative connotation.
Yeah. And I feel like too, like, not to demonize partners or anything like that, but sometimes partners are like, oh, is it your hormones? Are you hormonal? Is that what's happening right now? Is that why you're irrational? Yeah. Not helpful at all.
There was, I mean, again, pros and cons to the internet and to social media, but there was a post in one of my mom's groups, and I was like, people are like, we're coming with our pitchforks and the fire. A woman had posted kind of one of these again. Am I being overly sensitive about this? And everybody's like, no, you're not. Where her like 3-year-old is throwing a tantrum. Like, I want the ice cream. I can't have the ice cream, is throwing a tantrum. And her partner's response was, isn't it a little early for that time of the month? And she went off on him. Yep. And he was like, it's just a joke. Like, obviously she's not in her period. She's only 3. Like, he was totally dismissive about it. And she was like, yeah, no. And she's like, am I being, and all of us are like, no, you're not. Like, don't start with that. Like, first off, like, shut it down now. You've got probably 6 to 9 years to stop that before now he's projecting that toxicity on your daughter. Yeah. But, you know, I was just like, yay, internet, that she got some support from the rest of us of like, some validation of like, did he mean it in a harmful way? No, he thinks he's joking, but that language is important. So have that conversation with him of like, look, I get that you're trying to joke about it, but here's how that makes me feel as a woman. Yep. And I don't want that for my daughter. Yep. Right. And I want you to do better and be a more supportive parent to your female child.
And show her what respect looks like.
Yes. And help set a high bar for who she chooses as a partner. Yeah. That she's going to choose someone who treats her with respect instead of repeating the cycle here. Exactly. Right. Because like, you know, he definitely was like, like, kind of, why are you jumping down my throat? Like, it's just a joke. And I'm like, I get that you mean it as a joke, but here's how it gets perceived by us, right? This language is really, really important. And not because everybody's fragile and not because nobody can handle anything. It's because we deserve to be spoken to and treated with respect. And that isn't just physical actions. More often than not, it's words. And it starts with your words. And just because you don't mean it, you don't get to choose how people receive stuff, right? And there are definitely people out there who expect everyone to be on eggshells all the time because they are fragile. That's also not realistic, right? You live in a society with other people, and you can't expect everyone to change everything about the way they go through the world to keep you comfortable, but also you exist in this world with other people. And the rest of the world can expect you to at least take into account, how are these words going to be received? What am I saying? Who am I saying it to? Having some awareness of your audience, and that, you know, I've told this joke 10 times and nobody's laughing anymore. What's wrong with all these people that don't think I'm funny? It's not funny anymore.
Well, the thing is too, right? It's like, a joke is a joke, but it's not a joke when it's at the expense of women's reproductive. It's just not.
When it's at the expense of anyone, really. A lot of comedy is about telling jokes at the expense of other people.
Poking fun at things, for sure.
And I think that, you know, there are a lot of comedians in probably the last 10 to 15 years who have been canceled because people believe they've crossed the line in making fun of people or groups or whatever. But I think it's safe to say in 2026, like, no uterus, no opinion. So, you know, you don't get to tell jokes and imply certain things and minimize or diminish an experience that you've never had.
Exactly. It goes both ways. Absolutely. It totally goes both ways. But I rarely, I don't know, maybe nowadays, but I rarely do see the other coin of things of, like, women going, oh, are you hormonal? To men, like, I
don't know. I joke with my husband about his menopause all the time, which is really funny that we have to change the name of it, even though the first part of it is men.
But I mean, in a relationship like that, right? Like, you guys could joke with each other and all that kind of stuff. But like for more of like an insult kind of things, it's always been at the expense of women's reproductive systems, which I find just like so insulting, but like interesting. Like, what? Like, we can do what you can't do. We can do something very, very incredible. And that is grow a human, birth a human, and raise that human and feed that human. You can't do that. So why is this a joke? Like, why do we have to be an insult? Why is this weaker? Why is that whatever? And that you see it, again, going back to it, you see it bled into pregnancy, birth, postpartum, and how we talk about
everything
infants.
Around it. Right? I think a lot of it still comes from lack of understanding or misunderstanding, right? I mean, so much of the research and the information, even that is published and still taught, came from men, or even came from our knowledge of the male body. So I do still think there is a lot of misunderstanding, misinformation. Go online and look up where men think tampons go. Like, just some of these interviews with men about asking them really basic questions about the female reproductive system. And a whole lot of them don't really know. And these are men in their 20s and 30s and 40s. And so, so I do think, you know, misinformation or just lack of information on the whole is a big part of it. But yes, it's across the board. And then it just kind of seems to then, we kind of put that on babies. And I think a lot of times it's because we don't understand. We don't understand why they're crying. We don't understand why they're not sleeping. We don't understand why they can't latch. And so then it's, well, the baby, they're lazy, they're needy, they're fussy. It's all these really negative connotation.
They're going to manipulate you
Mm-hmm.
and all these things. I'm like, what? They don't have that cognitive function yet.
They're literally, everything they're doing is literally to survive.
Yep.
And they can't do it without us.
Mhm.
So,
Yeah.
but yeah, I think there's still a lot of it, and every word doesn't work for every person.
Totally.
But I think there are definitely words that have a more neutral connotation,
Mm-hmm.
even if it's not fully positive.
Yeah.
Trying to at least remain neutral with our language.
Mm-hmm.
Neutral for me, of course, is always defaulting to like proper anatomical terms.
Yeah.
Some people really get freaked out by that.
Yeah.
But as soon as I know somebody doesn't want to hear that, I'm not going to use that language around you anymore.
Yeah.
Right.
Yeah.
Yeah. Some awareness and some mindfulness.
Mhm.
And I think for those of us in the birth world, like, we are very much in a time where we have an opportunity to begin shifting the language.
Yeah.
Because if we are doing it with everyone having babies right now, then that language then can carry through to the next generation of people having babies, to their kiddos, and we just, it's a clean slate. It's a fresh start, right? With what is the language that we're using.
Yeah.
As we discuss all things reproductive health.
Yep. Definitely. Yep. Love it. Yeah. We thought it was an important one to touch on because we hear it a lot because we're in this space all the time. And we want you to know that it's not great. It's not normal for these things to be labeled the way that they are. And we are wanting to reframe a lot of that for you and have you understand, like, if it doesn't feel good, if it doesn't feel right, there's a reason for it. As always, if you have any questions, drop them in the comments. If there are things that we mentioned that you have heard before and have questions about it, great. But also too, like, if we didn't say something that you have been told, drop it in the comments. We want to know some of these like crazy things that people get told in their pregnancy and postpartum and motherhood and birth and all that kind of stuff too. Because we're always curious and want to learn more. So as always, thanks for listening, and we'll catch you on the next episode. Thanks so much. If you found today's episode helpful, you can subscribe, share it with a friend, or leave a review. It helps this podcast reach the families who need it most. You can find us at Belly Bliss in Denver and online for resources, workshops, and support. Until next time, take care of your body and trust its wisdom.